Hello and welcome. If you're just turning 65, or perhaps you worked a couple extra years and now you are retiring, calling it quits, baby, headed for greener pastures and warmer weather, hopefully. Congratulations if that's the case. Either way, you are qualifying for Medicare and you're going to be on some of the best coverage, believe it or not, that you've ever been on in your life to help cover your medical bills. Now, my name is Russell Noga. I'm the founder of Medisupps.com. We are an independent online insurance agency helping seniors for over a decade now to find the best Medicare supplement insurance. Well, today I'm going to be covering the list of Medicare supplement plans that are available. There are 10 plans to choose from, but don't worry, most of them make no sense. There's only a couple different plans which are going to be the best and most of you will enroll in. I'll cover the details of those plans, how to enroll, and how to stay out of trouble and not overpay. Perhaps you've begun this search already and you've come across the Medicare Supplement Plans comparison chart. I'm going to jump over to that chart for a moment and cover how to read it. It can be a little confusing, and then I'll dive into those most popular plans. Now, this is our plans chart, the Medicare plans chart put out by Medicare that most people start with when they're looking at the list of Medicare supplement plans and trying to decide which one. I personally don't think this is a very easy chart to read for new people. That's why I like to cover it with you and go over the benefits. So this is going to be very helpful to you if you're new to Medicare. Now, on the left-hand side, you've got your benefits that the various plans will be covering. And at the top is a list of Medicare supplement plans A through N. Couple letters missing. They got rid of a few letters over the years. I and J are gone, and they added M and N in there. N is one of the most popular plans. I'll cover that in a moment. So each of these check marks simply means that this particular plan letter covers this benefit. As you can see, A's got a lot of white squares in there that it doesn't cover. Almost nobody goes on Plan A except if you're under 65 and you did qualify for Medicare. Maybe that's the only plan your state offers. That happens a lot, particularly in like states like Texas. Plan B is not much different with a lot going on there. These are not plans you would ever enroll in. Many of these plans you'll see, B and D particularly, are they have less coverage and they're almost the same price, sometimes more expensive than Plan N, which has more coverage, which is why we don't write a lot of people on those plans at all. Now, Medicare C and F have a lot more check marks, as you can see. These plans were actually eliminated on January 1st of 2020. If you're new to Medicare on that date or later, you can't enroll in a C or F. Anybody who had those plans or was enrolled in Medicare prior to that date can keep the plan or still get that plan. I don't recommend Plan F, and I haven't even before they took it away, because Plan G is a lot better value for almost the same coverage. We'll take a look at the column of Plan G versus F, and you'll see there's just one white square that G doesn't have. If we follow that over to the left, what is that? Well, it's the Part B deductible, which means on Plan G, you're responsible for paying that, and Plan F paid it for you. Now, that deductible in the year 2020 is $198. I guarantee you on Plan F, you're paying far more than $198 for the plan to pay that deductible for you. Which means, let's say, for example, your premiums are $400 extra a year over Plan G. And we know the only difference is you pay the deductible or you don't. If you've got F, it pays the deductible for you. So you paid $400 for them to give you a $198 benefit. $200 going out of your pocket into the insurance company's pocket. When you could have had a Plan G, wrote the deductible yourself, and have been done with it and kept the $200. You can send it to me if you want, or whatever you feel like doing. But it doesn't go to the insurance carrier, which it does on Plan F. Now, Plan F also has higher rate increases than Plan G each year. It's a closed block of business, which means they're not offering it to new people. No new premiums coming in. The older people get, historically and statistically, the more claims they have. So claims are being paid out of the group. No new premiums coming in. That equals higher rate increases. I won't go too deep into the actuarial math of it all, but trust me on this, G is a much better option. You might want to keep Plan F if you never want to see a medical bill and you don't care what it costs. I understand that's a nice luxury to have. However, for most people, every dollar counts these days. Let's face it, 2020 is a crazy year, and you want that money back in your pocket. Plan G or even Plan N. Now, I'll talk briefly about Plan N. In our list of Medicare supplement plans, Plan N is the fastest rising in popularity by far. Plan G is the most popular right now. Plan N is a close second. Plan N is almost identical to Plan G, but you see a couple more white squares. Well, the Part B deductible is one of them, so it's just like G. You pay the Part B deductible. However, this Part B excess is not charged. Or excuse me, it's not covered under Plan N. What is that? Well, Part B excess charges are pretty rare. What that means is if the doctor you visit does not take the assigned rates for Medicare, meaning Medicare has its own table of assignment and how much things should cost. A doctor can choose for the entire practice if they want to accept assignment or they want to charge 15% extra or up to 15%. But it has to be for the entire practice. It's not just on a case-by-case basis. A big medical procedure comes in, they can't say, "Ooh, I'll take the 15%. It's not how it works. Now, Plan N doesn't cover the excess charges, but most doctors in this country take the assigned rates. I'm not saying they all do. You're going to have to call your doctor and ask. Chances are they'll say, "Sure, we take assignment," because doctors actually get hit with a penalty if they don't. Now, Plan N doesn't cover Part B extra charges, but if your doctor doesn't charge them, they're good to go. Now, you might be saying, "Russell, what if I see a doctor that does?" Well, you just pay a percentage of a percentage. It's very low cost. Now, I will tell you this. Small percentage, it could happen. I'm not saying they never will. In 11 years, I've never had a client ever tell me they got an excess charge. I've got my own mom on Plan N. She absolutely loves it. She's never seen an excess charge. So, just saying, don't be too concerned about that because Plan N has much lower premiums than Plan G. Why is that? Well, there's a couple other reasons. See this little copay signal here, this little footnote of copay. After you meet the Part B deductible on Plan N, just like you pay it on Plan G, you could have a small copay per doctor's visit each time you go for the rest of that year, because that deductible is a calendar year deductible. Pay it once, it's paid for the year, and it resets every January. On Plan N, the next time you go to the doctor that year, you might get a small copay. Now, it will never be more than $20. That is the max the copay can be. Often, though, it's less. It could be $6 or $9 or $13, I've heard, or nothing. You could have no copay. It just depends on what they code the visit for. There is one other thing for Plan N that's not listed on this chart that could come up. If you visit the emergency room and you've got a Plan N, there's a $50 copay if you're not admitted to the hospital. Why do they do this? Well, a lot of people go to the emergency room for things that are not emergencies. I know, crazy, right? Well, it happens all the time. This is to keep them from doing that. They'll say, "Well, sure, you can go to the emergency room, but if you just got the sniffles and you go home, $50, $50 copay." So that's how it goes with Plan N. However, there are much lower premiums on Plan N. And if you're healthy, you don't go to the doctor a lot. I've got clients who never go. They're very healthy. Or they go once a year, get their checkup, and they're done. You could save $30, $40 a month on Plan N, depending on what part of the country you're in. So that's a great option. Plan N is. Plan G as well. But the only way to find out really is to let us help out. Why is that? Well, again, we're an independent agency. We shop all the companies for these plans to make sure you don't overpay on your premium. The easiest way to get rates and find out, just give us a quick call. 1-888-891-0229. In a matter of just 5 or 10 minutes, we'll learn more about your situation, match it up to the different plan letters and companies that are available in your area, and make sure you don't overpay on your Medicare supplement coverage. So my name is Russell Noga, again, with Medisupps.com. Thanks for watching, and I look forward to speaking with you soon.